Welcome everybody to my presentation. My adjustment topic that I am going to be talking about is how to adjust to a loved one with cancer. I want to start off by saying that I have had no personal experience with this topic, and all of the information is based off of references and other people's experiences. So I am no expert at this topic at all, but I will be trying my best to explain how I think you should adjust to this topic. The first thing that I'm going to cover is why I chose this topic. The reasons why I chose this topic is number one, it is an extremely common disease that has major effects on lots of people. Number two is it usually comes when you least expect it. Number three is individuals will know somebody affected or be affected by cancer sometime in their life. Number four is people have no control over the outcome because you never know what truly is going to happen. And my last reason why I chose this topic is I've never dealt with it personally, so if I do, I will have this for reference. In this slide, it shows some statistics about who is affected by cancer nationally. So in 2020, an estimated 1,800,000 new cases of cancer will be diagnosed into the United States, and 600,000 people will approximately die from the disease. Along with that, approximately 39.5% of men and women will be diagnosed with cancer at some point during their lifetimes. Next, I would like to discuss the types of stress that cancer causes. The most common types of stress of adapting to a loved one with cancer are financial difficulties, usually due to the costly prices of appointments, chemo, and medication. Watching the loved one go through this sickness or having to deal with the chances of death can also be a huge stress, and huge life changes of having to take care of that person. The source of stress is simple. Cancer is a chronic stressor, meaning that it's a threatening event that has a long duration period and no clear time limit or ending point. You never truly know when it will end or what the outcome may be. Next, we will be looking at the common responses to these types of stresses. Looking at common responses, there are a range of negative and positive emotions that come into play. For the negative emotions, there are anger and frustration, anxiety and fear, and sadness and grief. These usually play a factor when the family receives bad news or the individual is getting sicker. People tend to lose hope and convert to negative emotions. As for the positives, lots of individuals show gratitude for the journey and having time with their loved one, optimism and thinking of the best of every situation, and growing close with that individual. Next, we will be looking at the type of coping mechanisms. Just like the common responses, there are a certain number of negative coping mechanisms people usually turn to. These include giving up, indulging themselves to make them feel better, and aggression. Negative coping mechanisms in this situation will not help at all, so try to avoid them as much as possible, even though it is hard to avoid them. There are also a number of positive coping mechanisms, such as rational thinking, which can help you not worry so much on the worst case scenario, but instead focus on the better. Positive reinterpretation, where you start thinking that things could be worse, and you can remind yourself that you're grateful for the time that you have with the individual. Seeking help or expressing emotions can help you take off the pressure of what you are dealing with by just letting out your feelings and emotions. Exercise is the healthiest way to deal with overwhelming emotions. So just like taking a walk, going for a bike ride, or going to the gym can help you deal with your psychological drainage. Meditation such as yoga can help you clear your mind and reset. And lastly, spirituality such as praying can also relieve stress. Next, I'm going to be talking about the story of a girl by the name of Katie Smith who lost her mother when she was in 8th grade due to breast cancer. Katie is placed on the far left of the photo that is present. Her mother's cancer was a long terminal battle that had no clear endpoint. Her mother never got the chance to watch her play high school sports or witness her graduation, along with many other life obstacles. The death of her mother put a lot of stress on her, but so did the cancer journey itself. Her and her family knew it was terminal, meaning that she would eventually pass away from this disease. When I interviewed Katie, she said that her biggest coping mechanism was her family. Katie tried therapy, but she said it wasn't for her. She also mentioned that her sister went to therapy and loved it, so it really just depends on how you deal with therapy and what you get out of it. One thing that she said was very helpful during her journey was that she always asked for what she needed. Whether it be time off from a job or an extra time on an assignment from school, she always asked for what she needed, and she said that always helped. And even though the journey was difficult, she said that she grew a lot in the situation that she was in. She learned to never take advantage of anything else in her life ever again. At the end of my interview with Katie, I asked her one piece of advice to anybody who would ever go through her situation. She said that her advice would be continue to live your life how your parent or other would want you to. So coping and dwelling is completely normal and okay, but day to day, it's important to remain positive and do what you need to do to make them proud. Work hard and make a future for yourself that you are proud of. We don't always pick the situation and the struggles that come our way, but we can choose how to handle them. Choose happiness and love and live with a much fuller and cheerful heart. When researching this topic, I came across an article written by Sally Taylorson called Mom's Breast Cancer Diagnosis Changed Our Whole Family Dynamic, in which she gives 10 tips that she learned while coping with her mom's breast cancer. Her 10 tips include: don't be afraid to ask for what you need. They are your parent. They've seen you at your best and your worst. Number 2, recognize that things may change. Everyone reacts to life-changing news differently. Number 3, being there is the most important thing. Showing that you can be by their side is the number one thing in this situation. Number 4, ask for what you need. You need to do this to feel secure and supported. Number 5, it is okay to feel down or confused. It is a scary new experience, it's exhausting, and it is okay to say so. You don't always have to put on a brave face. Number 6, you don't have to tell everyone what's going on, so give as much information as you feel comfortable with. You don't have to tell everyone every single thing all the time. Number 7, plan nice events together. A lot of your time that you guys are going to be spending together are going to be at appointments or at chemo or just talking about this situation, so make time outside of these appointments to create good memories. Number 8, speak to your employer. Most employers will be understanding that you are under a lot of stress. Number 9, ask if you can speak to a nurse. If you don't feel so super comfortable discussing all of your questions or concerns with whoever you're dealing with, it's okay to speak to a nurse as long as the other person feels comfortable with you knowing the information. And number 10, keep healthy and take care of yourself. Care for yourself just as much as you do for your parent or for anybody else in this situation, because you are your number one priority. When doing research for what coping methods were found to be scientifically helpful, I came across an article called Coping with Cancer: The Perspective of Patients' Relatives, that did studies on how most people cope with a loved one with cancer and what their typical responses were and what methods were the most helpful. One study was done on how parents and siblings of children with cancer cope with this situation. So the parents' negative emotions are that they will have an increased risk of anxiety or depression after the diagnosis, and they usually suffer more psychological distress than the actual child with cancer. For the siblings, they often deal with negative emotions such as helplessness and school difficulty, along with the feeling like they are the invisible children, where they feel irrelevant and that their problems are irrelevant. So what were the best ways for help? Studies show that the healthcare professionals, such as therapists and counselors, support groups, and social support from family and friends turned out to be the best coping mechanisms. The second study was showing how children of parents with cancer cope. So the negative emotions that kids deal with are usually that the cancer impacts the psychological well-being of the children. Their family routines are disrupted due to appointments or the parent not being present or able to do certain situations, and the likeliness or anxiousness of death. And how do we cope from that? So the 4 most relevant were receiving therapy, learning to portray emotions, support groups, and social support. Some resources are the Cancer Hope Network, which is a national nonprofit organization which offers free and confidential one-on-one emotional support to adult patients with cancer and their families. And the second resource is the American Cancer Society. This provides many articles and ways to get help and also what to do. They have a chat box to talk to anyone about what you need within the website or just what to do in general. And they also have Caregiving 101, which is a caregiver resource guide. And then lastly, I'm going to talk about some books that people have written about what to do when you're in this situation. The first book is Helping Yourself, Help Others. This is written by the former First Lady, Rosalind Carter. And she thinks that caregiving is such a critical issue that she has now established an institute to research policies and practices. So within this book, she uses real-life caregiving stories to get the support that they need. The second book is The Human Side of Cancer, written by Jimmy C. Holland. It guides people with cancer and their caregivers through all aspects of the experience, including strategies for coping with anxiety, communicating with the healthcare team, and living with uncertainty. The author also includes discussions of psychological effects of radiation, surgery, transplants, and other treatments. Although the caregivers are not the book's main audience, they will likely find its insights and information useful in understanding the experience of their loved ones. And the last book is called Things I Wish I'd Known. And this one is basically practical lessons drawn from caregivers' experiences that are woven with their own words and the most intimate feelings to forge a compelling narrative about the full range of issues you'll face as a caregiver or patient. And the last thing that I'm going to discuss is the limitations for this presentation. Limitations include that I was only basing my research off my perspective. I've never dealt with this issue personally, so I would not know what works effectively and what doesn't. Another limitation was that my example and the scientific evidence was mainly on average income white families. And the last limitation was that this was also based towards what families adjust to, which leaves out friends and other people that adjust to the cancer as well. Here are my citations, and thank you for watching this video.